Good morning, everyone. My name is Holly Lampa, and in this presentation, I'll be explaining what dysgraphia is, describe how it can impact a student academically in the early primary years, and strategies primary school teachers can use to help students succeed academically. Now, before we begin learning about dysgraphia, I'd like to go over why, as a teacher, you are obligated to help a student with a disability. By differentiating, you are demonstrating your ability to treat every student with dignity, respect, equality, and fairness. You also have a professional obligation to ensure that students with a disability can participate in school activities and the curriculum on the same basis as students without a disability. Dysgraphia is a neurological disorder that impacts a person's ability to write. There are 5 different types of dysgraphia: dyslexic dysgraphia, motor dysgraphia, spatial dysgraphia, phonological dysgraphia, and lexical dysgraphia. I've included pictures of the first 3 so that you can better understand what they look like and how each type can impact a student differently. It's important to note that unlike the first 3, phonological and lexical dysgraphia may not present itself in writing. Rather, you have to look at the student's spelling ability, their ability to blend phonemes, and how reliant they are on sound-to-letter patterns. It's not essential to be able to label a student as having a particular type of dysgraphia, but rather to be aware that dysgraphia can present itself in many different ways. For the sake of teaching, look for students who show signs of having significant difficulty when it comes to forming letters, using proper spacing, sizing their letters, whether or not they have proper hand grip when writing, do they have the ability to stabilize their hand when writing, if they produce illegible writing, and have significant difficulty when it comes to long writing tasks. It's important to note that students with dysgraphia most likely will produce poor handwriting, but that does not necessarily reflect their cognitive ability or their ability to express themselves verbally. In fact, many students with dysgraphia can express themselves verbally quite well. But given how important writing is in the everyday classroom, it is important to note that students diagnosed with dysgraphia may exhibit challenging behavior due to how difficult it is for them. And this behavior may be shown as task avoidance, or acting out in frustration, or even acting out due to the pain it causes them. And this is because they lack the fine motor skills to do the writing task. Now, depending on the level of task avoidance or acting out behavior that they exhibit, it may be important to put in place a positive behavioral strategy plan with Tier 1, 2, and 3 behavioral management strategies to help students when doing a writing task. Now, it's important to note that Tier 1 level is really for everyone, not just the student with a disability. In writing, this could mean defining behavioral expectations, such as having everyone have a go at the writing task, and rewarding them for their effort, not just the product they produce, and setting consequences if they do not do the writing task, such as coming out back during their break and completing the writing task they avoided. Tier 2 strategies could be individually checking in with the student that is diagnosed with dysgraphia to see how they're tracking and to see how confident they feel with the task, and identifying any resources you could provide them to help them with the writing, or even, when possible, allowing them to complete the task in another way, such as scribing for them, letting them use Windows H, or even verbally providing an answer, which would be appropriate in, say, a science lesson or a math lesson. Now, Tier 3 strategies should rarely be used, and I think would only apply if the child does not attempt a writing task and acts out every time and will not have a go. If that's the case, you need to get everyone involved. And by everyone, I mean parents, teachers, aides, or even occupational therapists, in order to develop an individual education plan that addresses developing their fine motor skills, identifying tools that will assist them in writing, and to help students learn strategies in self-calming techniques and becoming more confident in their writing ability. Other types of support and accommodation you could use to help students who struggle with writing is to allow them to use pencil grips, graphic organizers, or graph paper to help organize their writing. To explicitly help a student with dysgraphia, you should teach them how to use Windows 8 so that they can do speech-to-text typing. Allow them to have additional time on writing tasks. Let them provide verbal answers versus written ones in order to decrease their workload, and allow them to use adaptive paper when doing a writing task. In the next slide, I'll explain how you can use adaptive paper as a strategy to assist students with dysgraphia in writing. It's essential not only to build a positive relationship with your students, but also with their parents or legal guardians, because parents' involvement can have a significant positive impact on a student's academic success. Some examples of ways parents can help would be doing play-based sensory writing activities at home. Those writing activities could be practicing writing letters or pictures in sand using their fingers or a stick, using different sized pieces of chalk to write their letters, or again, a picture, or even using Play-Doh as a way to build the letters, because that builds their knowledge about the letter, but also will help develop their fine motor skills and muscles in their hands. I hope you found this video helpful when learning about dysgraphia, and thank you for watching.